Hi, my name is Zach Camden, and I would like to talk to you about the importance of hand washing. My project is focused on the importance of good hand hygiene and how implementing some very basic steps can help mitigate the spread of sickness and illnesses among society. Even with the continuous advancements made in medical technologies, hand washing has still been proven to be the simplest and most cost-effective way to mitigate the spread of disease. By properly washing your hands, you're able to not only keep yourself from getting sick, but also protect those around you. Healthcare workers are constantly exposed to many infectious diseases, and by implementing proper hand washing techniques, they are able to protect themselves and also prevent the spread of disease from patient to patient. I have prepared a presentation about the importance of hand washing. This presentation, titled The Importance of Hand Washing, will talk about the true impact of proper hand hygiene. It also covers the do's and don'ts of good hand hygiene, as well as giving some important data and statistical figures regarding bacteria on the hands. The first slide is called the basics. This slide lays out the simple 5 steps that the Center for Disease Control recommends for proper hand washing. Step 1, wet your hands with clean running water and liquid soap. Step 2, lather hands with soap, ensuring to get the backs of hands between fingers and under nails. Step 3, scrub for at least 20 seconds. Step 4, rinse under clean running water. Step 5, dry hands with clean and, if applicable, disposable towel. In my paper, I talk about each step individually and how the Center for Disease Control meticulously wrote each one of these steps in order to prevent any cross-contamination and make sure that the most effective process of hand cleansing is achieved. The first step of this process is very important. It says use clean, warm, running water to wash your hands. It is important to use clean water when washing your hands because you don't want to be adding bacteria to the surface of your hands when you're trying to wash bacteria off your hands. This would just negate the process of hand washing. It is also important to use warm running water when washing your hands. Bacteria and microorganisms all have an ideal environment type that they live and grow in. By using warm water, you're going to elevate the environment around the bacteria to a point to where its growth rate and death rate are elevated. So by using warm water, you're actually keeping the bacteria and microorganisms on the surface of the skin from growing, ultimately killing the bacteria quickly and more effectively than using room temperature or cold water. By using running water, you're able to effectively rinse off the bacteria from the skin surface. Stagnant water has been proven to carry bacteria and microorganisms in it, and by washing your hands using still and stagnant water, you could inevitably be adding microorganisms to the skin surface. Running water will effectively help rinse the skin of any microorganisms and bacteria that don't belong there. The last portion of step 1 mentions the use of liquid soap. The Center for Disease Control was very specific when they said use liquid soap because any other method of soap, such as a bar of solid soap, can be an increased transmission of bacteria. A solid bar of soap has the potential of drying out between washes and can grow bacteria on it between one wash to the next wash. It also, even if slightly, increases the chance of cross-contamination if the bar of soap is shared between 2 people. Step 2 is a simple step. Lather every area of your hand to ensure that soap and water is effectively cleaning all of the areas. You want to try to get as much bacteria off the surface of your hand as possible. Step 3 is short but very important. The Center for Disease Control is very specifically saying to scrub your hands for at least 20 seconds when washing them. 20 seconds is the minimum amount of time it takes to kill and evacuate the majority of bacteria from your hand. Step 4 is short and straightforward. When you're washing your hands, just ensure you're using clean, warm, running water. When applicable, step 5 also contains one final step. When using a sink that has a manual faucet handle, be sure to use a clean towel to turn the faucet off after you're done drying your hands. If you touch the faucet handle with your bare hand after your hands are clean, you run the risk of spreading microorganisms and bacteria back onto your skin surface. Slide number 2 has facts that many people do not know when it comes to hand washing. 1 in 5 people do not wash their hands, and of those that do, only 30% of them actually use soap. On items such as cell phones and keyboards and purses, there are more germs found there than there are toilet seats. This is important because these items are items that are touched frequently with fingertips, hands, and even faces. Germs can survive on your hands for up to 3 hours. This is why it is important to wash your hands frequently and properly. Naturally occurring bacteria, known as flora, are always present on your hands. This naturally occurring bacteria is there to protect against pathogens and infection-causing bacteria. The next slide is an image that I made to depict what a square centimeter looks like. 1,500 bacterial cells can be found for every square centimeter on your hand. Now that seems like a lot, but remember, there are two types of bacterial groups found on the human hand. The majority of the bacteria on the hand are harmless. However, there can be harmful bacteria found on the skin surface. This is why hand washing is so important. The next slide discusses how bacteria spreads. Given that there is always bacteria living on our hands, anytime we touch our eyes, mouth, or nose, that bacteria is immediately spread. There are two types of transportation methods that bacteria can be spread through: direct transmission and indirect transmission. When you cough or sneeze into your hand and then touch your eye, this is an example of direct transmission. Indirect transmission can be seen as shaking someone's hand when it may not be clean, or touching an unclean doorknob and then touching your eye, nose, or mouth. An unclean hand or a doorknob can be seen as a vehicle for bacteria to move about. Hands are the #1 mode of transport for bacteria and germs. Because bacteria and germs can spread so easily due to unwashed hands, this is why it is so critical to wash your hands after using the restroom, before prepping and cooking food, or especially when you feel ill or cough or sneeze into your hand. In the mid-1800s, a researcher with the last name Semmelweis conducted a study and found that many hospital setting diseases were transferred via hand contact. Semmelweis conducted research comparing two different clinics and their maternal mortality rates. He found that one clinic had a much higher maternal mortality rate than the other, and he was wanting to figure out why that was. He began to compare the habits of hand washing of the two clinics. He found that the doctors, nurses, and medical students of the clinic with the higher mortality rate were improperly or insufficiently washing their hands when finishing an autopsy. The healthcare workers would finish the autopsy, wash their hands inadequately, and head straight to a delivery room. Semmelweis said that the hands often had a disagreeable odor when entering the delivery room still. This led Semmelweis to believe that if a more effective method of hand washing would be implemented, then the mortality rate would decrease. Thus, he suggested a chlorinated lime solution be used when washing the healthcare workers' hands after finishing the autopsy prior to entering the delivery room. The mortality rate for that clinic dropped from nearly 20% to below 3%, and it stayed low thereafter. Thus led Semmelweis to believe that proper hand washing techniques can help the spread of disease. This slide was an important fact showing that 80% of common diseases and infections are spread by germs and bacteria carried by the hands. This slide is a quick comparison of using soap versus sanitizer when wanting to cleanse your hands. The Center for Disease Control has already recommended the use of warm water and liquid soap when washing your hands, because it is the best method to get rid of the most germs and bacteria from the surface of your hands. However, if washing your hands with soap and water is not available, alcohol-based hand sanitizers do make a suitable alternative. There are drawbacks for using sanitizer over soap, however. Using hand sanitizer does not effectively get rid of as many germs as washing your hands does. It is also not effective if your hands are already dirty or greasy. Hand sanitizer does not effectively wash harmful products or chemicals off the surface of your hands like soap and water does. Life is better with clean hands. This is the most recent hand washing campaign from the Center of Disease Control. Another one from the CDC is known as hand washing, keeping your family healthy. There are many different types of health campaigns regarding hand washing. Another one is Save Lives. This is one from the World Health Organization. Each one is very similar. The basis is proper hand hygiene. Typically, they can be seen using colorful illustrations showing proper hand washing techniques and often statistical data showing important facts about the spread of bacteria. The next slide goes over some very important numbers and data regarding hand washing. The Center for Disease Control like to use some data with their health campaigns. Some important figures that they shared were 1 out of 3 cases of diarrhea sicknesses can be prevented with proper hand hygiene. Also, hand washing can prevent 1 in 5 respiratory infections in the community. This final slide is a wrap-up of the hand washing presentation. Approximately 40 seconds is the amount of time it takes to properly wash your hands. After using the restroom or before preparing food, everyone can spare 40 seconds when they can wash their hands and protect themselves and those around them from potential bacteria they may be carrying. You may not get sick, but if you do not wash your hands, you may get someone else sick. Practicing proper hand hygiene is the easiest, cheapest, and fastest way to protect yourself, prevent illness, and maintain a healthy life. It only takes 40 seconds, roughly the time it took for me to read this slide. Wash your hands. The concept of hand washing is not a new concept. Throughout the years, there have been many different health campaigns regarding the importance of proper hand hygiene. You can see these health campaigns targeted in very specific areas. The example that I used in my paper is pairing an internet ad with an online cooking recipe. This can be very beneficial in a hope to increase the amount of people that wash their hands prior to cooking food. It is very important to figure out who you are targeting and where your health campaign is going to end up to make the most impact. You can see health campaigns about hand washing posted in public restrooms above the sink, as well as throughout hospitals and healthcare facilities, encouraging healthcare workers and visitors to properly wash their hands to prevent the spread of disease. Battling infectious disease and illnesses will always be at the forefront of healthcare. Even with the advancement of medical technology, proper hand washing and hand hygiene will always be the most effective way to keep yourself and those around you safe from infectious disease. If, as a community, everyone implemented hand washing techniques into their day-to-day lives, community diseases such as gastrointestinal diseases and respiratory diseases like the cold and flu will be greatly reduced. Hand washing is easy, simple, cost-effective, and anyone can do it. If everyone were to wash their hands properly, a community as a whole will be healthier for it. This slide was an important fact showing that 80% of common diseases and infections are spread by germs and bacteria carried by the hands.